Hello, I'm Alan Woodward from Suicide Prevention Australia. We're going to have a wonderful suicide prevention conference this year. Today, I would like to thank you for registering to attend or present, and I look forward to seeing you there. Right now, I would like to speak with you about ways for us to talk about suicide and to be safe and exercise self-care while we're at the conference. It's important to talk about suicide. It's an issue of community concern, and in general, having a conversation with someone does not increase suicidal behaviour. We're going to be talking about suicide a lot at the conference because we have the shared passion for an Australia free of suicide. However, we do need to proceed with caution due to the potential risk of causing unintended harm to those attending the conference who are vulnerable to suicide. Suicide Prevention Australia has therefore, with the support of Everymind, developed some guidelines for key actions you can take as a presenter and an attendee when talking about or presenting about suicide or mental ill health at the National Suicide Prevention Conference. These actions aim to support and safeguard yourself and others. So firstly, if you're a presenter, when it comes to presenting or discussing topics which relate to suicide or mental ill health, it is important that you speak to consider a range of factors ranging from the language you use to referencing help seeking and acknowledging the diversity of audiences in attendance. You should give acknowledgements. Ensure that you have considered the full spectrum of audience attendees and include a respectful acknowledgement of those with lived experience of mental ill health and suicide, Aboriginal Torres Strait Islanders and other Indigenous persons in the room, and outline that you intend to use safe language during the presentation and throughout the conference. Speaking publicly about suicide can contribute to community engagement, better understanding and improved access and use of help-seeking pathways if it is done safely. We therefore ask presenters to, firstly, use appropriate language when communicating about suicide. Avoid referencing suicide out of context, for example, references to political suicide. Avoid presenting suicide as a desired outcome or glamorising a suicide attempt using language such as successful suicide. Avoid sensationalising suicide or creating a moral panic, talking about suicide as an epidemic, for example. Avoid the discussion of details about the method and location of suicides in public forums. If necessary, ensure the audience knows that for the next few minutes you'll be presenting information about suicide, and if you're referring to methods of suicide, provide advance warning so people can choose to leave the room if they wish. Give a warning also if you're presenting on a program or research that is specifically focused on the reduction of access to means or specific locations where suicide may occur, so that no assumptions are made as to who might be comfortable with that discussion. Secondly, avoid simplifying suicide. Suicide is a complex issue and no single factor leads to someone taking their own life. So when you speak about suicide, be mindful to reinforce the complexity which is in fact our understanding of suicidal behaviours. Avoid pointing out any one single factor as the root cause of suicide. Thirdly, consider cultural factors if your presentation touches on priority populations. Fourthly, always include help-seeking information as part of your presentation, especially if your presentation includes content which may distress some people in the audience. This help-seeking information ensures people are encouraged and reminded that support is available for them to directly access assistance as they wish. For attendees and anyone speaking at or during the conference, here's a couple of points. Firstly, know where you can get support during the conference. There will be 2 counselling rooms, a quiet room, the standby booth, and representatives with green lanyards roaming the conference, all as places and people that you can obtain support from if you need someone to talk to. There are also the 24/7 support services that you can access via phone or online. Secondly, using safe language is a sign of respect for the diversity of people who attend the conference. We recognise that it's important to talk about suicide, but please be mindful of others and the choice of your words. When speaking at or around the conference, as you mix with people and network, please minimise disclosing explicit information about your own experience or that of others without seeking their permission first, as it may distress them or negatively impact on those people who are feeling vulnerable, including those who have been bereaved by suicide. Fourthly, minimise the details about methods and locations where a person has died by suicide. It is not generally appropriate to talk about methods and locations in casual conversations, even at a national suicide prevention conference. Although you may be comfortable with the conversation, others within hearing range may not and may be caught off guard and become distressed. Fifthly, know how to politely stop a conversation if you're feeling impacted or distressed. If you feel uncomfortable by a conversation, it's okay to politely stop the conversation and take care of yourself. Here are some simple lines you could use. You could say, for example, "I'm sorry, I'm not comfortable talking about this. Can we change the topic?" Or you might want to say, "I really would prefer we talked about something else right now, please." Or, "If you don't mind, could we stop talking about this, please?" I want to describe to you the Aboriginal and Torres Strait Islander language policy for the National Suicide Prevention Conference. Suicide Prevention Australia respects that descendants of the first inhabitants of this country, now known as Australia, have personal preferences for terminology used and would like us to accommodate those preferences. It is acknowledged that there are many cultural differences between and within Aboriginal and Torres Strait Islander communities, and the use of differing terms does not intend to disregard such differences. It is noted that the terms Aboriginal and Torres Strait Islander and Indigenous are often used interchangeably. With respect to the distinct cultural and language differences of people and groups on the mainland and the islands, and in consultation with our Indigenous Advisory Committee, Suicide Prevention Australia has the following language policy. Firstly, where appropriate, conference presenters and participants are to make a distinction between Aboriginal and Torres Strait Islander people. Secondly, the following terms are to be used: the traditional name of a people or group, such as the Wadi Wadi group from the region I come from, the term Aboriginal and Torres Strait Islander, the term First Australian or Indigenous Australian. Do not use acronyms such as ATSI at all. Thank you for listening. We look forward to seeing you in Melbourne for the National Suicide Prevention Conference in 2019. Thank you.